Okay, so today what we're doing is we're talking about the nurse's role at the time of birth, and as we can see, Mrs. Sims here is crowning. Her birth is imminent. So there are four things that you have at the time as part of your role at the time of birth. One is to assist her with pushing. The second one is to prepare the room for the birth. So one of the things that I would have done is I would have gone from my instrument room over here and I would have set up an instrument cart right here to be ready for the time of birth. I want to ensure that the necessary personnel, so I've already rung the buzzer and I've asked for a second nurse to come, and when she comes she's going to bring the infant warmer and she's going to be in charge of the baby. At the time of the delivery, there needs to be one nurse whose attention is on the mother and the other nurse whose attention is on the baby. And note that the other role that you have as the primary labor nurse is it's your job to maintain and continue to watch what's going on the fetal monitor, because you're watching how this baby is adapting to the last stages of the labor. You're also noting the time of the delivery, and you're noting the APGAR scores, the time of the birth of the placenta, but your primary role here is to help Mrs. Sims and her husband over here, Charlie, because especially Charlie may be over here and you may look up and notice that he's on the far corner, because the sounds, the emotion that go with birth, lots of times fathers will step back from the bed, and that's where you have to say, you know, Mr. Sims, come on up here and support your wife. Come on up here next to her so you can be right here with her with the time of the birth. You really don't want the family down at the bottom of the bed. That's saved for the physician or the nurse midwife who's going to do the delivery. And then your job is to take the linen off. You're going to be moving the linen, and you'll be positioning her and putting her legs up here in the stirrups and getting her ready for the actual birth. I'm not going to take off the whole bottom of the bed today because it really takes two of us, but you will be positioning Mrs. Sims into the stirrups. You may even have to raise the head of her bed to get her ready, and then you're going to be dropping the foot of the bed and you're having her completely ready. Now, one of the things I want to tell you is that you never take off the bottom of the bed until the provider who's going to do the delivery is actually present at the foot of the bed. And I'm sure you can understand why. We don't want little Ricky Sims being born into the drop bucket underneath the bed. We want the provider right there. We want them gowned and gloved and ready to do the delivery, because if suddenly she pushes and the baby starts to come and the provider's not here, I've got my gloves, I can put my gloves on, and I can just reach right down here and receive Ricky myself onto a padded, stable surface. Okay? So again, your role at the time of delivery is to support your patient, to get her into position, to continue to watch the fetal monitor and monitor the well-being of this baby, to note all the times, and to get the appropriate personnel here for the delivery. That's part of the role of the nurse in labor and delivery.